Fatty liver is associated with high cholesterol, hypertension, and obesity. Although it's not easy to detect, there are various symptoms that can indicate this disease. What are the warning signs of fatty liver? Are they easy to spot? Or can only be detected by laboratory tests? Are dark urine and high temperature among them? We're talking all these and more. Fatty liver occurs when fat accumulates in liver cells. This is a condition in which the liver is unable to perform its tasks effectively. What is the role of the liver? The liver is in charge of several functions: controlling fat metabolism, getting rid of toxins in the blood, and producing protein. Therefore, it's important to keep our liver in good condition. If it is unable to perform its functions, the health of the rest of the body suffers. As a result, the affected person begins to feel a variety of discomforts. Some are so frequent that they can be mistaken for other health issues. People who drink too much alcohol on a regular basis are more likely to develop fatty liver. However, alcoholism is not the only risk factor for this condition. Other risk factors include having diabetes, being overweight, maintaining unhealthy eating habits, having high cholesterol levels, etc. Fatty liver is usually asymptomatic. That means that it is difficult to identify until the person is tested. Some tests that are used to detect this condition are liver ultrasounds, liver biopsies, blood tests. However, it should be emphasized that some patients may experience symptoms or certain health issues that are linked to fatty liver. Now let's take a look at 5 warning signs of fatty liver that you should never ignore. Number 5. Pain in the abdomen. One of the warning signs of fatty liver, according to some patients' experiences, is abdominal pain. It occurs in the center or upper right area of the abdomen. However, it doesn't have to relate to a particular activity or exertion. It can appear after the meal because the stomach expands and presses against the enlarged liver. Number 4. Abdominal bloating. Another possible alarming sign is abdominal swelling, which is also known as ascites. Ascites is a condition in which fluid accumulates in the abdominal cavity, and it can lead to an infection in the abdomen. The symptoms of ascites are indigestion, abdominal distension, breathing problems, back pain, and ankle edema. Number 3. Dark urine. We can detect some illnesses or disorders through urine. Remember that this liquid contains toxins and waste. The urine will have a darker color than usual if you have fatty liver. In addition, the stools may change color, be whiter or clay-colored, and have a stronger odor than usual. Number 2. Fatigue. One of the possible warning signs of fatty liver is feeling extremely weak and tired. As the liver cannot function well, the body's metabolism slows down, resulting in unexplained tiredness. It's also possible to have issues with concentration and confusion, among other things. Number 1. Changes in the skin. One of the other common signs of fatty liver has to do with changes in the skin. The most significant difference in the skin when there is a fatty liver is jaundice. Jaundice is a yellow discoloration of the skin due to abnormally high levels of bilirubin in the blood. Discolored neck and armpits, reddened palms of the hands, spider veins, and fragile capillaries are some of the other skin changes due to the fatty liver. Now, what are the steps you can take to reverse fatty liver? Once a fatty liver diagnosis has been made, the next step is to start proper treatment. In addition to the drugs that your healthcare professional may prescribe, it is important to follow a low-fat diet. Here are a few suggestions. Limit your intake of refined products, such as flours and white sugars. Instead, choose whole grains and whole grain versions. Follow a Mediterranean diet. According to research, eating a Mediterranean diet is probably the healthiest option for both weight loss and liver health. Stay away from alcohol. It's one of the liver's worst enemies. Furthermore, excessive use of alcoholic beverages might result in liver cirrhosis. Participate in sports. Regular exercise aids in the correct functioning of the liver system. It is recommended that you practice it at least 3 times per week. Rest is necessary, but you should also exercise a bit each day, to help with the healing process, and to promote the health of the rest of your body. Thank you so much for watching till the end. Make sure to check out our other videos.